I'm here today to talk about peer support, and this is a bit of a, I hope it's not a dream, but in some ways it's a bit of a dream that I would love to have peer support taken forward as one of the innovations in secure care. And these are the benefits. Some are qualitative rather than quantitative, but increased hope, empowerment, problem-solving skills. Perhaps I wouldn't have expected that, and more social interaction, which perhaps I would have expected, but also the benefits for the peer workers themselves, so the people who are providing peer support. It has a clearly beneficial effect, a reason to work hard, as it says in this quote, a real reason to look after myself better. It's made a real big difference. And also better for organisations. I think this is a really good quote as well from a team leader from one of the pilot sites for the project. I just stand back and watch him work his magic, not just with the patients but with staff too, and I think that's very important to an important benefit. And the person could help people see things in a completely different way. And I know that certainly from my time in secure care, I think that probably I would have, because I was quite a handful, as if you slipped the pig from Neeswood House a few pounds, I'm sure they'd tell you a bit about what I was like when I was first admitted, which was 6 years ago, nearly 7 years ago. So I have changed, it does work quite a lot since then. But I think I would have listened more to somebody with a lived experience similar to mine, who'd preferably experienced being somebody in secure care. Another reason, which hopefully will help tip the balance, is its cost effectiveness. Now, the studies were done in America. There were some controlled trials, 6 studies that looked at the benefit-cost ratios, and they've been translated into NHS prices. I'm not quite sure how they do that, but and 4 out of the 6 studies were extremely positive, and overall the cost-benefit ratio was 4:1. So a service for the cost of employing a peer support worker, they saved 4 times that amount in terms of efficiency, moving through care pathway, other costs. So the evidence is very suggestive that it's very cost effective, and I think that that is something which in secure services is potentially very important. But of course there are problems with peer support and peer support working in secure care. For example, what exactly is the precise role within a secure care setting of a peer support worker? What about safety and security? And gosh, we must never forget that, but also I don't think that that's an excuse for us not to implement something like this. There are issues around confidentiality, but they're not insurmountable, obviously the CRB thing. So under the coordination of the charity Together, which people might have heard of, and they do a lot of service user involvement in peer support work in general mental health services. We've got a small national group together, and I'm one of the service users on the steering group, and we're just literally next week starting to do a scoping project in 4 sites. We're doing focus groups, questionnaires, going into the pilot sites and really asking people what is it that they would like. And the results of the scoping should be through the end of February next year. There's a paper which I put together against not a particularly scientific paper, but I went up to this Yorkshire and Humber group where they've got a really big service user involvement group that meets once a quarter, and we're talking about 60 people, so sort of 3 times the number of people, or twice the number of people in this room, and they're a very vocal lot. So if you want to know what service users in secure care, apart from the other recovery and outcomes groups and the rest of the country, you know, the Yorkshire and Humber are probably the most outspoken. And we said, what would peer support look like for you? And it would be delivered by people, not surprisingly, experienced in mental health services, preferably secure, and that the person would be trained, supervised, preferably paid. I went last summer to spend a day with a peer support group in Nottingham, and it was absolutely fantastic. They have peer support workers that work 16 hours a week. They're paid at band 3 level. They have contracts with the trust, and they spend 6 weeks at a time with service users, inpatients and outpatients, and they do lots of things ranging from running recovery groups, escorting people on leave, helping people sort out their benefits. They work with people during the transition from inpatient to community care. And it's that kind of thing that people were talking about in Yorkshire and Humber as they would like to see in secure care, and I think that that would be something which would be really innovative. They were very keen to make sure that peer workers weren't going just to fill in shortages in staff. They weren't to be taken on, as healthcare workers not turned up today, will you do it? Very clear that it was a different role, and that the role should include practical help, emotional support, supporting people in activities which can be quite difficult. For example, the risk assessment process, CPA processes, accompanying people to ward rounds, and these are things which really do happen in peer support projects in general mental health services, and I would hope that we could work towards them happening in secure care as well. And they particularly found it helpful to support people in their interactions, which might be quite difficult with staff, and that was one of the things which the Yorkshire and Humber people were very keen. I'd like somebody to support me at the times when I find it difficult to make my own voice heard. I'd really like somebody to be there with me. So there's a summary of the workshop and the results. As I say, it's not completely scientific, but it hopefully will give people a flavour.